The Senate is set to vote on extending Obamacare tax credits as a major spike in health care costs looms, and Republicans are split on getting a deal done.
I think there are some parts of the Obamacare policies that are positive, but there's ways to reform this, and it's not just sending more money to insurance companies.
I don't know that you can completely remove it, and I don't know exactly even what that means. We have to have stability and certainty in the market.
Borrowing money from your kids and grandkids to hide what someone actually costs doesn't lower costs. I don't think we have a choice, because if we stay on the Obamacare path, we will bankrupt the country.
I think we need to do a radically new choice option and introduce that.
Our next guest is the author of the #1 New York Times bestseller, The Miracles Among Us, How God's Grace Plays a Role in Healing. Fox News senior medical analyst Dr. Mark Siegel joins us now. Hey, Dr. Siegel.
Hi, Ainsley. Good morning.
Hi. Good morning. So what do you think Republicans should do? Some are saying scrap it, Obamacare. Some are saying save it.
I think it's a transition, and I don't think it can be saved. Let's not forget that when the individual mandate was removed under Trump 1, you had a really good thing happen because young people were paying for insurance they didn't need and didn't really help them. It's not health care necessarily. So then you had the thing starting to collapse under its own weight because you're only taking care of very sick people and you don't have doctors that accept it. You don't have many hospitals that accept it. And if you're in that donut hole, if you're in that deductible part, you may not even get the care you need. So it's not working. The exchanges, these insurances are not working. They've been propped up by the government with hundreds of billions of dollars in subsidies, which got worse under the COVID pandemic. And now we're faced with that. I like what Bill Cassidy, Senator Bill Cassidy, said on Fox News Sunday. He's all in on the Trump plan to start to give the money right to the patient rather than to insurance companies. The big dogs, the big insurance companies have already backed out of Obamacare. So you're basically subsidizing an insurance that doesn't work. Give it to the patient, increase health savings account, more choices. Now, Ainsley, practically speaking, I don't think this is going to happen over the next 2 weeks. I think Cassidy is right. I think the president is right. But I think what you're going to see is an extension of the subsidies for maybe a year. You are not going to see what Chuck Schumer is saying, 3 years extension of this system that is helping to bankrupt the government. Really bad idea, the Schumer plan.
Well, Dr. Siegel, congratulations on making the New York Times bestseller list. You have worked so hard on this book, and it's wonderful. It's called The Miracles Among Us. And so many people have been inspired by this. You got a letter from an ICU nurse who said your book was wonderful, and she does believe in miracles. And she was talking about how sometimes doctors and nurses could give up too quickly to allow a patient to experience a miracle and heal. This is what she writes to you. Sometimes doctors and nurses give up too quickly. Just because many die with head injuries, it is worth it to try more than a couple of weeks. We had one patient with a gunshot wound above the ears. We thought he would die, but he started following commands and saying words after 10 days. It bothers me that there is not always a good balance between longer care and quality of life. Insurance may be a factor or lack of faith. If a patient doesn't recover in a few days, it doesn't mean there is no hope. What was your reaction to that?
This really touched me. It probably was a reaction to us talking on the show here and you and I saying, send me your miracles. And what this nurse, Glenda Hayes, who trained in Texas, is saying, and her husband, by the way, a pediatric oncologist, even more touching. He's saying, the husband saying, don't give up on little kids that are trying to survive cancer so soon. And she's saying, a neuro ICU nurse, people come in after head injuries, even gunshot wounds to the head, like Andrew Wolf, and she has seen them recover. She has seen them go out of the hospital. And Ainsley, when I was beginning my training, I saw somebody wake up from a coma after 3 months after head trauma with the family praying at the bedside every single day. And most of the residents in the ICU saying, what are they doing? What are they doing? There's no hope here. And he went back, he walked out of the hospital and he went back to work. And it changed how I practice medicine. I've never been the same since then. I give people a chance to recover. I do everything I can to get them to recover. That's what the book is based on.
That's amazing. I know you helped with my mom. You gave me such good advice, and she lived for an additional 5 years after her stroke. A lot of that was because of you and Dr. Raj down in North Carolina. So thank you, Dr. Siegel. Your book is incredible. It's called The Miracles Among Us. It's out now, and its Fox Nation special is also available now on foxnation.com.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.